So just finish it.
Everybody got it?
Yeah. Orientation.
Got it. Alicia, you got it? Okay. Make sure you can see the book, huh? Not just like on your card, that it's working on your device. Okay. You got it, Jessica. Carla, you already have it. I think. Ashley. Check if you can see and read it and scroll. Aaron said you got it. Josh, yes. Sam, yes. Jesse, yes. Emily, this time. Yeah. Maria. Maria likes the physical book. She bought it. So let's start. You see my copies? Yesterday I didn't leave until I made the copies because they're thick. I don't want the computer and copier to stay. Okay. Think what would you want? This is for freshmen, but the ones who were here, you should have this already. Pharmacology 101. Okay. We're gonna do this again because this is the basis or the foundation of pharmacology. First class is pharmacology, second class is the dependence. That's good. Okay. So to the others who've been with me and have learned this, I expect you to know at least some. Okay. I'll start with pharmacology terminologies or concepts, or I call it pharmacology 101. 101. 101. Say 101. 101. Okay. So there are concepts in pharmacology where you have to understand so that you can understand how the drugs work in your body and how your body processes these drugs. Did you ever wonder, like, if I take this pill or drug, what happens inside of me? Right? What happens inside of me? Or how does it lower my fever? How does Tylenol lower my fever? How does ibuprofen help with inflammation or swelling or soreness? Did you ever wonder that? Yeah? No, I just take it because the doctor said so. Maybe you should ask those questions, right? Maybe you should ask those questions a little bit. Okay, so let's talk about those two terminologies. Pharmacokinetics and pharmacodynamics. I hope you guys put your syllabus grading scale in the basket, because you get a 0 if you didn't. Oh, I can't say. Or the other thing. Two very important terminologies in pharmacology. Remembers. Okay? Remembers. Okay. Pharmacokinetics versus pharmacodynamics. What does pharmacokinetics mean? What the body does to the drug. Very good. So there's an acronym that should first come to mind when you hear pharmacokinetics. And that is AGRI. Okay. Some books would say LADME, some books would say LADMER. Okay. But we're going to simplify it to the core. Okay. What the body does to the drug. Body, what's A? Absorbs the drug. You agree? The body distributes the drugs. The body, oh my God, I'm proud, Mama. Metabolizes the drugs. and the body excretes the drug. So we're going to make it now absorption, distribution, metabolism, and excretion. When you hear pharmacokinetics, the first thing that should come to mind is admin. Okay. If it's an oral drug, which most 80% of our drugs, okay, where, which part of your body, where does absorption happen?
Small intestine.
Small intestines. This is not the official abbreviation. Just so you know, I'm just putting it because I have little space. Okay, small intestine. Where does distribution happen?
Bloodstream.
Bloodstream, or what we call the systemic circulation. Okay, where does metabolism usually happen? Where does excretion usually happen? Speaking of excretion, can we excrete drugs through sweat? Yes. Can we excrete drugs through breast milk? Yes. Okay. So if you know this terminology and you remember admin, okay, you know what the body does to the drug. Now let's put examples into it. Say a drug. Before I give you examples, let me define the other terminology first, so it's better. Okay. If pharmacokinetics is what the body does to the drug, pharmacodynamics is what the drug does to the body. How do I remember? So I don't flip-flop because I have a problem remembering two options. D, what the drug does to the body. Okay, what the drug does to the body. So if we take a Tylenol, brand name Tylenol, generic, acetaminophen, Tylenol, Tylenol. Oh, are you serious? This is the third one. I want to stick to the blue because I started with that blue. Tylenol is an antipyretic. Anti against, pyro as fire. So what does Tylenol do?
Reduces fever.
Reduces body temperature or fever. Right. What did the drug do to the body? It lowered elevated body temperature. Pharmacodynamics. Okay. Oh, law. Good job. Beta blockers. What do beta blockers do? Lower blood pressure. They're using that now, right? Lower blood pressure. What did the drug do to the body? Lower the blood pressure. Drugs that end in prazole. PPIs. Omeprazole, lansoprazole, esomeprazole. Freshmen are like, it's okay. You can't relate? You will be able to in a few days. Yes, because like, she's just a sophomore and she's nodding her head. Okay? The book that I gave you, 200 drugs, there's a secret to that. You don't memorize the 200. Listen to what I said. I said Olol here. I said Prazole here. Remembered about 15 drugs already by knowing that. You remembered about 10 drugs already by knowing this. Let's go back. Prazole, omeprazole, lansoprazole, esomeprazole, PPI. What is it for? So it's for GERD. What did the drug do to the body? It helps reduce stomach acid. Know these two terminologies? You're golden. I wish my bless you. My pharmacology professor explained it this simple. Give me more examples. Drugs and their use. So what did the drug do to the body? Here, give me an example of drugs. It can be a brand name generic, it can be a group of drugs, it can be a class. And then what does it do to the body? I gave 3 examples.
Yeah. Oh, yeah. Statins.
Example. Statin. I heard it. Statins. What do statins do? Simvastatin and atorvastatin. So if it's for high cholesterol, what does statin do to the body?
Sure.
Lower cholesterol levels. You following? Right, always false. Like, always false. Now I'm gonna go with one ear.
Glad it is, but
I put 2 locks at the back, still does it. Anyway. Freshman, okay? Okay, because I'm gonna move on. Okay. Now, let's go back to pharmacokinetics. When I asked you guys or the class, where does absorption happen in the small intestines? I specifically asked most oral drugs. Okay? Because the injectables don't work like that, especially IV drugs, right? IV stands for intravenous. So where do you think absorption and distribution happen? In the bloodstream right away, right? Does it pass the liver for metabolism, you think? Some do, but most don't. Because the liver is part of the digestive system. So any drug that passes through the liver for metabolism, what do you call that metabolism or process? First pass. This shows up on the board exam. First pass effect or first pass metabolism. If it doesn't pass the liver for metabolism, we call it no first pass. No first pass effect. And these are your injectables. Okay? And these are your injectables. They don't pass the liver, especially IVs. Okay? You see how even the sophomores just went back to this first. This is going to be the first ever lecture you will have in this classroom. And I don't need a PowerPoint for this. And you shouldn't too. Okay? What I'm trying to say is you should know this by heart. Because if you understand this concept, you understand how the drug works in your body. Okay? And then how your body would react to drugs. Okay? First pass effect. What do you think is the absorption of IV drugs? What percentage? 100%. And that term you just answered is what you call bioavailability. Bioavailability. So bioavailability is the amount of drugs that make it to the systemic circulation. Because it's IV, it's injected through your veins. How much of the drug is in your system? 100%. What if it's a tablet or a capsule? Do you think it'll be 100%?
No.
No, because it will go through metabolism, disintegration. Okay? So which one do you think has a faster effect, IV or oral drugs?
Doesn't last as long.
IV. Depending on the drugs always, okay? Depending on the drugs always. Bioavailability for IV drugs will always be 100%. But for your tablets and your capsules, it's less than 100 for sure. Because it will pass through your gastrointestinal system. It'll pass through the liver for metabolism. By the time it reaches of action, less than 100, right? And this is the reason why we have different dosage forms. Because the dosage forms, when it comes to absorption, matter. The speed of action matter, right? Picture this. Somebody's face was damaged from an accident. Could you force that person to take the medication by mouth? No. So what's the form that we're going to have to give that patient? Injectable. The patient kept vomiting. Are we going to force that patient to take a tablet, a capsule, or even a solution? What's going to happen? The patient is just going to throw it up. So what's the best form we usually give? Suppository or injection. The terms I'm using, tablet, capsule, suppository, are called dosage forms. These are the dosage forms of the drugs. The form or the format that the drugs come in. Okay? So, is it a problem if you take children's Benadryl?
Is it a problem?
Is it a problem?
Yeah.
Will there be a problem?
Yeah.
Why?
This is for children. It's how can I say it?
It's $100.
Thank you.
Argue. I want somebody to argue that.
It's I don't know.
Sorry, hot flashes. Hot, cold, hot, cold. You laughing? Your mom? It's a hot, cold.
I went there and on.
Okay. Argue, Steve. He said, no, you cannot take that children's medication.
No, I went there.
Huh?
I'm agreeing with Aaron. I was trying to get it out.
This is louder.
I just think it would be consistent with the underdose. You took the adult, unless only thing is if it's a drug that's by weight and you're a very small person. There's people under 105 pounds that's grown, they can possibly take it and it may work for them.
You're getting there. Okay.
True.
Fun fact. I take children's Zyrtec. But I know the children's dose and I know the adult dose. Okay. I take children's Benadryl. But I know the children's dose and I know the adult dose. Okay. So if the children's dose is 12.5 ml and I want to take 50 ml, how much do I take of that? 12.5 ml per 5 ml, say for example. I'll take double. But you could do that. One time we ran out of children's Benadryl. I had the pink tablets. What did I do? I crushed the tablet in half. Okay. Put it in apple juice and voila. It's nothing. Like the smoke and dust is really killing me. My face is so itchy that I have to take 2 Benadryls. 2 25 milligram Benadryls. So this does not knock me out. Okay. But it helps with the itching. Okay. They're still on an unhealthy air level, so wear a mask. I keep forgetting to wear a mask outside because I'm afraid that it's even gonna itch in my face. Okay. But anyway, yes, you could. Okay. Could you do adults to children? Depending on the dosage form. Yeah. What if I have an adult's Benadryl in liquid form, right? So I'll just dose it. If it says per 5 ml and it's half the dose, I'll just give my son 2.5 ml. That's where your math comes into play. Okay? Not always the case. But a dosage form is important for you to be able to change those. Okay? But no one's stopping you from taking that. Doctor prescribed you 800 milligrams of ibuprofen. It's a prescription. 200 milligrams is over the counter. Who's to stop you from taking 4 of that because you don't have an insurance? Are you following? Okay, so those are important things like pharmacokinetics. If you don't have an insurance, the doctor, if you have an insurance, you want the doctor to write that prescription because your insurance, your copay is $5 or $0, right? Instead of buying a bottle of ibuprofen, taking 4. Are you following me? Okay. Pharmacokinetics is what the body does to the drug. Pharmacodynamics is what the drug does to the drug. Bioavailability is the amount of drug that makes it to the systemic circulation. Okay? There's another terminology that I want you to remember when it comes to absorption. And that is what you call half-life. The symbol for half-life is T1 half. T will be in percent, and half-life will be in time number of hours. You will see this in drug monographs. You will see this in product inserts. Okay? Say, for example, drug X has a half-life of 8 hours. Okay? And this is how it looked like. Okay? So there's going to be 0 in your body. Okay? And then it's going to peak, right? And then it's going to go down because it's going to be excreted, this process. You following? The amount of drug. You can't stand up, Ashley. You know, it's hard to see. Okay. So the drug amount in your system, in your bloodstream. Okay. How important is half-life? If it's a pain med, you don't want to feel the pain, you want to be able to take the next dose so that it doesn't go all the way down, right? Inflammation, whatever it is, okay? And take it again. So that you have a level or a concentration, okay, where the drug does its function, okay? And this is what you call a steady state concentration, okay? But how is half-life important? At 8th hour, if a drug has a half-life of 8 hours, that means half of that drug has already been eliminated. Okay? So, if drug X has a half-life of 8 hours and drug X is 500 milligrams, on the 8th hour, how much is in your system? 250. On the 16th hour, how much is in your system? 125. On the 24th hour, how much is in your system? 62.5. And it keeps on going. Right? And that's why it takes a while for a drug to be off of your system. Okay? Marijuana stays longer in your system. Does marijuana have a longer half-life or a shorter half-life? Longer. When a drug stays in your system longer, half-life is longer. Okay? That question shows up on the board exam a lot. Remember your detectives question? If a drug has a longer half-life, what will happen to the drug? And one of the options is the drug will stay longer in the body. So a higher half-life, say for example, 16 hours, does it have a higher chance of toxicity or lesser chance of toxicity?
Hi.
Higher chances of toxicity. You follow? Yes? Couple of terminologies that you know, you're golden. Okay. Even the supplements are responding to me already. Because they had their notes. They won. Wasn't this your first lecture? Your first ever lecture? This is your first ever lecture. It's easy to find.
Okay.
Alright. Do you understand, freshmen? Yes? Okay. I'm giving you a minute to absorb these terminologies because this is the backbone of pharmacology. Okay? This is the backbone of pharmacology. And I don't blame you. It's true. When a doctor prescribes us something, you just take it. Right? But I hope we're that curious child who questions, what will this do to my body? And how do you know that? You ask for the product insert.
16.
How do you know that? You go to medscape.com.
16.
You go to references. Men and Gilman.
16.
Okay. WebMD. Tell you that. Your gut tells you. This happened to me. I never say I'm a pharmacist. Like to my son's doctor or whatever. My son was prescribed an overdose. I forgot the drug already, but I knew it was an overdose of something. Okay. And when I go to the pharmacy, this is a long time ago, he was still a baby. I don't say I'm a pharmacist too. I said, could you double check? I think there's something wrong with the doctor's prescription. And the pharmacist said, you're right. I hope all moms are like you. Said the pharmacist. But can you imagine, the reason I pretended that is not to deceive the pharmacist. Yeah. I was thinking, what if really I'm a mom and I'm not a pharmacist? I just get it. I just give it. Pharmacists, because they're busy, will probably just give it. And that's where medication error happens. So question, when something feels wrong, ask. Okay? The staff here, because we've been together a long time, I'm like a 24/7 hotline for drugs. One time, one of the MA instructor's sons got rushed to the ER, and it was 1 a.m. And I told you I don't sleep until about 2:30. That's when I fall asleep. And so she texted me. She said, "Ate is big sister in Filipino. Ate, Dawson is in the hospital. And this is the prescription. I think it's wrong. I think it's too high." Yeah. She's in the medical field. She's a nurse too. And so I said, yes, it is. But she hasn't been in practice. I said, yes, it is. Question it. I said, question it. Question it. Okay. Now, with this information and whatever you're going to learn throughout the program, knowledge is power. You get to take care of your loved ones better. Your little brothers, your little sister, your parents. Okay. I assigned an MTM project to the seniors, Poirier. You're one of them. Okay. How was that for you? Who did you interview?
My mom.
Your mom. Okay. What did you realize, knowing what you know, going through her prescriptions? Like, is she taking too much medication? You think the medications are helping her? She's just used to the medication.
She'll take 2 pain medicine, medication.
She has maintenance though?
Yeah.
Maintenance drugs? Okay.
Yeah, so she's learned like she would take like 2 a day.
What's the maintenance for?
Um,
Cholesterol or? I know I saw your report. I'm just thinking. We had 2 projects last sequence. One's MTM and the other one is observing a pharmacist. The sequence is fun. You're gonna go to an herb
This for
store.
her CRPS, so more of her muscle, for her back.
Okay. Was this, no, this wasn't from the recent accident. This was prior.
No, she's, my mom has CRPS,
Okay.
so.
So everything's right? You think in the prescription, it helps her, the prescription helps her?
Yeah, and she barely takes her lidocaine patches too, so.
That's
it really,
good.
it just
Just as needed.
Yeah, and then like up here, like right her like not really where her spine is at, like kind of like above her booty. And
Okay.
that's when it changed.
Have sciatica. The joys of aging, huh?
That's right above her.
Yeah, no, because her butt is like on her back, like she's.
Okay.
That's right, but so like that caused the problem too, because like how she sit too, because I know. So it's like,
Say profile.
yeah,
There's no back curvature.
yeah, it's curved. That's why I said
I
like
have
this.
scoliosis,
Instead of
so
sitting like
very
this. It's just up there. Yeah.
Okay. You said there's nothing wrong with her prescription.
Yeah. No.
Sometimes we'll catch a mistake. Like with my mom, she had so many prescriptions, 7, okay? And then I said, this is a duplicate, this is a duplicate. I told this story before, okay? And she was like, that's what the doctor gave me. Okay. I'm just a pharmacist.
Yeah,
Right?
right? She doesn't like taking the pill. That's why. So she only takes it when she's in pain. But my mom does a lot of walking, so she can like stretch that out.
Yeah.
So she won't have to take it because she don't swallow pills. She has to chew. So yeah.
Even if it's not a chewable tablet,
Yeah.
she chews
So
them.
she asked her. She asked before because she has to chew them. She cannot swallow.
Okay.
She would. Yeah, she could do.
So my mom, she got 7 and she said, that's what the doctor gave me. Okay. And then she ran out of refills. I had to call the doctor. This was when she just moved here. I had to call the doctor, so I had a home service doctor, and the doctor said, Mama, this is a duplicate, this is a duplicate. Now she's down to 3 or 4. As I was telling her, those are duplicates. Okay. Yes, Kathy.
It's just the same medication, just different name then?
Depends. It depends. That's why the seniors, I had them do an MTM, a MedRec project, medication reconciliation project, because I wanted them to see if their own loved ones or family member has duplication, and that's a common problem with doctors or going to different doctors. The other doctor didn't know that you were already prescribed this, and then you go to another specialist and you're prescribed another drug that does the same exact thing, but either a different brand name or a different class. Right? So it's very important to look for that, especially if you go to different doctors. And that's why it's important when we take our loved ones, especially our parents, to the doctors to bring all of their prescriptions. Always bring all their prescriptions or have it on record. And now we have all those phones that can save all the prescriptions that we have or medical information. Okay, so it's handy. Yes, Kathy.
So that's why they ask you when you go to the doctor, what medicines are you taking? So they
Yes, yeah, because sometimes you go to a cardiologist, but you also go to another internist, right? And then you go to an OBGYN, right? There's so many. And that's why one of the things on the form when you check in is medications that you're taking. And here's another thing. It's not just medications that are prescribed that you should be mindful of. You should also include the over-the-counter medications, especially supplements. I've been talking about this a lot, especially supplements. Supplements are over-the-counter. Okay, why? A lot of people think that supplements are safe because they're natural. But there is a problem when you combine supplements with other drugs or even food. And I'd like you to pull out your phones right now and go to the book that I just gifted you. Because there are drugs that don't go well with supplements. One example, St. John's wort should not be given to patients who are taking St. John's wort,
Oh, this is alright.
SSRIs. Okay? At the back,
This is alright.
this is my beat up book. My hardcover, I don't carry with me. Okay. So at the back of your book, I'm going to help you guys out. Page 60. I don't know if it's a Kindle. What page? Drug interactions.
95.
Okay. So I was already thinking of an update on this book because I didn't include drug and supplements. Okay. I included drug to drug interaction, drug to food interaction, and drug to disease interaction in here. There are drugs, when you say drug to disease or drug to condition, there are drugs that you should not take if you have liver problems. As of this. There are drugs that you should not take if you have kidney problems, or the dosing has to be adjusted. Okay. There are drugs that you should not take if you had history of breast cancer. That's drug to condition interaction. Drug to drug interaction can be warfarin and vitamin K. Drug to food interaction, give me an example. Warfarin and leafy greens such as your broccoli, kale, spinach. Why? Because these leafy greens are rich in vitamin K. Give me another drug to food interaction. My mom's favorite, but she's on that medication. Grapefruit juice. Grapefruit is? Oh, I already erased it. Statins. Tylenol and alcohol. Okay? So, drug interactions right here. Okay? On the PTCB, 40% of the test, PTCE, your board exam, is medications. 26% is patient safety, which means 66.25% is drugs, which includes their interaction. Because if you take something that's not supposed to be taken, doesn't that fall on patient safety? Yes. Overdose amount, does that fall on patient safety? That's why many students or test takers fail, because they just memorize the drugs. They don't understand how these drugs work. I could have written this book and wrote just 100 brand generic therapeutic class. Remember I told you I hate the word memorize. I just did it for clickbait because students like memorizing and I don't like that. So I explained to you what they do in the body, what you should not take with them, because that's what shows up on the board exam. They want you to know that grapefruit and grapefruit juice should not be given with statins. They want you to know that St. John's wort should not be given with SSRIs. They want you to know that vitamin K should not be given with warfarin or Coumadin or other blood thinners. They want you to know, or they're checking if you know, that the number one side effect of Tylenol or acetaminophen is liver damage. Take note of that. They want you to know, or they want to check if you know that the number one side effect of NSAIDs, non-steroidal anti-inflammatory drug, is gastric. Know how they're going to ask you? They're going to say, a patient comes, it's a situation. Okay? Everything is word problem. Okay? And complains of bleeding. Which amongst these medications, there's 4 options, you think may have caused a problem? Ibuprofen or aspirin will be there in the options, and 3 others. And because ibuprofen or aspirin falls under the class NSAIDs, that will be your choice. And that is the correct answer. And it will also say a patient comes and has liver damage and was blaming it on which drug? Okay. Acetaminophen or Tylenol. And these are true stories. I had a student who said, Michelle, you know, I have ulcers now because my mom has always given me ibuprofen whenever I'm sick. Following, it's a lot of information, right? But don't get overwhelmed, freshmen. That's why I do it by chunks. Chunks of concepts, of information, of topic. If Steve remembered a lesson 6 weeks ago, you should highlight it in his own notebook. Any questions? Is there a topic or a specific terminology here that you want me to elaborate more before I move on? Okay. Let's talk dosage forms. I'm going to ask the freshmen, the juniors and the seniors and the sophomores. I said examples of dosage forms. Can you give me more, Maria? I said tablets and capsules. What else?
Suspension.
Suspension. This is where there's a powder and a liquid form. Yeah? And what should be the auxiliary label on a suspension? Shake well. Sequence 3. This sequence. You'll remember all those things. Okay. Shake well before you use it. Okay. Because that powder settles at the bottom. Okay. Give me another one, Alex.
Sublingual.
Sublingual tablet. This is a root or a route. Okay. A type of a tablet where you place it under the tongue. I have a story for that too. I have a lot of stories. I think you guys remember the story once you were here, right? Sublingual. What's the difference between a regular tablet that you take with a glass of water and a sublingual tablet? It dissolves under the tongue, right? So which one will have an effect, will take effect faster? The sublingual tablet, because under your tongue, if you look at the mirror or your phone, you'll see a lot of veins or innervations under your tongue. Okay. Back within 12 minutes on the average. Nitroglycerin sublingual tablet. What is it for? Angina, chest pain. Okay? If you're having a heart attack, you start feeling chest pain. Sometimes it's heart attack, sometimes it's heartburn. And that's why many people who are rushed to the ER, they check them if it's just heartburn and not a heart attack. Why was I discharged and I was given an antacid? Because it's a heartburn, it's not a heart attack. Okay. Anyway, if it's a true chest pain, difficulty in breathing, okay, and you know that you have history of that, and you have a nitroglycerin sublingual, okay, you place it under your tongue, and this is the reason why nitroglycerin sublingual tablets is one of the exemptions on the childproof cap, because you want to be able to open that real fast, place it under your tongue. It's an emergency drug. Why is that drug sublingual in form? Because it's an emergency drug. If you take it and swallow it, it will take an average of an hour before that takes effect. Sublingual takes effect fast. This has to go, a regular tablet will have to go through this. Okay. Take about an hour, sometimes longer. You following all the concepts? Okay. Give me another example, Emily, of dosage forms.
Suppository.
Suppository. Okay. Not a lot of people know what suppository is. Back in the day, suppositories are only this glycerin. Oh, come on. Bullet shape, like a gel. Okay. Where do you insert suppositories? Cavities in general. Okay. It can be rectal, but it can also be vaginal. You following? And here's the problem. Okay, but right now, let me talk about suppository first. Right now, they're rectal suppositories in liquid form with the applicator. Like there's a spout like that you insert in kids' rectum, and then you squeeze whatever it's like an enema. Okay. Back in the day, suppositories like this. But know that there are suppositories that look like a tablet. And you have to insert that in a vaginal cavity. So if you didn't put the root or the route, what do you think the patient will do to that tablet? Swallow it. So here comes your patient coming back to you saying, it's still itchy down there. I've been taking this for 4 days now, 5 days now. How are you taking it? And you look. You just said, take one tablet, instead of insert one tablet into the vaginal cavity. I don't want to say it, but when we translate our SIG, it has to be understandable by a kindergartner. Patient comes to you, okay, but before I say the next case, I'm telling you cases because this is how it's going to show up, okay, on your board. Before I talk about the next case, okay, patient complaining that it's still itchy down there, that it's not taking effect because she was swallowing it instead of directly inserting it into the vaginal cavity, which means it passes through this processes. And by the time it reaches the site, what do you think is the amount of drug that's in there? Almost nothing, right? Very, very little. She didn't get the correct strength of that amount that would kill that fungus or bacteria in there. Are you following? Okay. Another one. You'll say it's stupid, but it happens. When you work in retail, you're going to be surprised. I don't want to say it, how stupid people are. Okay. And this becomes a daily thing for you guys, and you just laugh about it. Okay. And that's why you'll think, no, it's not that. It's the lack of education. And that's why the pharmacy is a source of education. Okay. When it comes to drugs. Okay. Patient comes to you, complains of rectal bleeding. You look at the prescription, you put in his suppository insert into the rectum. Suppositories usually come in foil pack. You should have used the word unwrap, then insert. Well, the whole suppository inside a foil pack was inserted into the rectum.
You just call me an idiot.
Stop, Steve! Unwrap, then insert. This is the reason why I tell you why the verb on a SIG is important. The doctors don't put the words take, instill, apply. Are you following? But you have to put that. And you have to put the root or the route. The doctors are not fond of putting PO. They just expect you to know. Right? What happens to this? Give me more dosage forms, Sam. Inhalations. Okay. So this can be in aerosols or spray for your asthma. Aaron. Topical. When you say topical, what is that for? For your skin. So those are for external use only. Dermatologicals usually. Okay. What else? Eporia. Buccal. This always shows up on the PTCE because it wants you to know what buccal means. And what does buccal mean? Can you explain? You put that drug or tablet between the cheek and your gum, and that's how it dissolves. Do you think that absorption is faster than a regular tablet? Yes, because your gums have veins. Yes, Sika. Drops. What kind of drops? Eye drops. This is one statement you will learn in sequence 3 once you get to compounding. Eye drops can be used in the ears, but eardrops should never be used in the eyes. So sometimes you'll be surprised that a patient has an ear infection, but it's an eye drop. Remember that. Eye drops can be used for the ears, but eardrops can never be used for the eyes. Always comes up on the board exam. Why? Eye drops should always be sterile. Okay. Give me an example of dosage form.
So cute.
Subcutaneous. It's a route or a route. So we have drugs, injections that are solution form, and injections that are in powder form that needs to be reconstituted. Reconstitution, these terms you will learn once you're in compounding, second half of this sequence, okay? Reconstitution is powder, you add a diluent, usually water, to dissolve that powder. Because how are you going to inject a powder into the veins of the patient? You have to dissolve it first, okay? Carla, give me another example of dosage form. Patches? Patches! Transdermal patches. Okay, transdermal patches. Do you think it will have a faster absorption than tablets and capsules? Yes. Okay. Through the skin. Okay. Erin. Mm-hmm. Another one.
I think he didn't say.
Another one. I'm surprised I found a lot. I am intramuscular. These are routes or routes. Intramuscular. Okay. So this intramuscular drugs can be in solution form. They're injectable. Or it can be in powder for reconstitution form. Okay. These are examples of your dosage forms. And each dosage form have different absorption, okay, half-life, okay, how they're metabolized, which organ metabolizes them, okay. Tylenol was my example, and Benadryl and ibuprofen, because they are over the counter, and freshmen will be it will be easier for the freshmen to relate, because who knows Tylenol, right? Okay, who knows ibuprofen, right? Who knows aspirin? Right? That's why my examples most of the time are over the counter, especially for the freshmen, so that you can start relating. But this over the counter drugs have like side effects that always show up on the PTCE. Tylenol, acetaminophen side effect, liver damage. NSAIDs, examples of NSAIDs, ibuprofen, aspirin, ibuprofen is Motrin. Side effect, gastric bleeding or irritation. Okay, this is the reason why when I give my son ibuprofen, if I have to, I have him eat first. But when I give him Tylenol, it's okay if he hasn't eaten yet. One of the pharmacology information I've learned from one of my professors, one of my favorite ones, is most drugs are best absorbed on an empty stomach. Except for drugs that irritate your stomach. Most drugs are oral drugs are best absorbed on an empty stomach, except for drugs that cause irritation, like your NSAIDs, right? You want to give them food. Okay, why? There's no food in there. It's not going to fight for absorption, right? It's just going to be absorbed right away. Okay, but an empty stomach is different from a hungry stomach. What's the difference?
Stomach acid. I think.
Hungry, you haven't eaten all day. Hungry, right? An empty stomach is about 2 to 3 hours after a meal, because digestion happens after that. Okay? So it's okay for you to take it. Okay? But drugs that cause irritation, like NSAID, gastric irritation, you want to take that with food. Is that clear? Okay. Freshmen, you understand? Okay. It's a lot of concepts, but if you know these things, you are golden. Okay. Any questions? We're going to pause and breathe for a little bit.